Good afternoon, everyone. I'm Matt Walker. I'm a shoulder and elbow surgeon at OrthoVirginia at Schrader Road in Richmond, Virginia. And I'm here to talk about shoulder replacements in 2024. We're going to talk about outpatient replacements, customized implants, patient-specific implants, and augmented virtual reality in modern shoulder arthroplasty. Thanks for joining. So a brief overview of the talk. We're going to talk a little bit about shoulder anatomy. We'll talk about different types of arthritis that affect the shoulder, different types of shoulder replacement. Like I said, we'll talk about moving some of these patients to outpatient surgery centers, and we'll talk about some emerging technology in the field. So briefly, what is the shoulder joint? The shoulder is a ball and socket joint that's made up of the glenoid, which is the socket component, and the humeral head, which is the ball component. Those are the bony structures in the shoulder. There's several ligaments that surround the shoulder that help stabilize the joint. And there's several muscles that attach to the shoulder. The rotator cuff muscles are the ones you guys have probably heard about. There's 4 of those muscles, but there's 13 other muscles that connect the shoulder joint to the shoulder blade. So 17 muscles move the shoulder, making it a complex joint with a lot of moving parts. When the shoulder joint is normal, our joints are covered with cartilage. Cartilage is the lining of the ends of the bones that provides a smooth gliding surface between the bones. It allows for some shock absorption between the bones, and it lets your joints move freely and easily. When you develop arthritis, it's when the cartilage surface breaks down. So if you're seeing this slide in the top right corner, those are arthroscopic photos. The photo on the left shows a nice smooth ball. On the right, that shows a ball with shoulder arthritis. You can see there's some fraying of the cartilage. There's a loss of that nice smooth contour on the bottom surface of the ball. And when that happens, you can develop narrowing of your joint space. You can develop irregular surfaces on the ends of the bones, and you can get these bone spurs. All of those things can cause the shoulder or other joints in the body to move less smoothly, to catch, to creak, to lock, to make noise, and to give you pain. When it comes to the shoulder, several different types of arthritis affect the joint. And the reason that's important for shoulder surgeons is that different types of arthritis require different treatments. This slide shows 4 different x-rays. On the far left is regular wear and tear arthritis. The next one to the right is what we call rotator cuff or cuff tear arthritis. The third part is an arthritis that's caused by crystal deposition. Sometimes we call that a Milwaukee shoulder. And on the far right, we have rheumatoid arthritis. So each of these might be treated with different types of shoulder replacement. Shoulder replacement's a little bit different from hip and knee replacements. The same companies that make hip and knee replacements make the shoulder replacements that we use. But in general, hip and knee replacements all look similar. They all look like a metal and plastic version of your native hip and knee. When it comes to shoulder replacements, there's 2 main types, which we've shown here on the screen. On the left, the photo shows an anatomic replacement where the ball and socket looks like what God gave you. On the right, there's what's called a reverse replacement, which looks nothing like what your native shoulder looks like. Why are there 2 types of replacements? The reason why is the shoulder joint is a complicated joint that's powered by 2 different muscle groups. The main group is the deltoid muscle and the rotator cuff muscles. Normal shoulders require both of those muscle groups to work. When the rotator cuff is not working, you lose a balance between the deltoid and the rotator cuff, and the shoulder joint becomes unstable. What happens when the rotator cuff tears is the deltoid muscle pulls the shoulder proximally or upwards, and that causes the shoulder to become unstable. And next slide. That's demonstrated in this video. So the picture on the left is a model of a shoulder replacement for a shoulder similar to our native ball and socket joint. The deltoid is pulling that shoulder upwards and it's getting caught underneath the shoulder blade, which is depicted by the cartoon surface on the right. The video on the right shows what a reverse replacement does. It balances the force of the deltoid and increases the stability of a rotator cuff deficient shoulder. So who gets what kind of replacement? Well, that's not always a straightforward question. In general, if you have wear and tear arthritis, if you have a good rotator cuff that's working well, and you have minimal deformity of your socket or your ball, you might be a candidate for a shoulder replacement that's an anatomic replacement. Patients that have a bad rotator cuff or a rotator cuff that's not working for some reason, or a bad deformity of the ball side or the socket side would be candidates for reverse replacement. In general, this is not a straightforward question because we also base these things on physical exam. We base them on how old the patients are, what the rotator cuff looks like, if you've had rotator cuff repairs in the past, if you've had surgery for instability of the shoulder, if you have bone loss or deformity. All these factors can play a role in what you might wind up with. I get the question very often, is one shoulder replacement better than the other? Is a regular replacement or an anatomic replacement better than a reverse replacement? And I think that that's not also an easy question to answer. I think a lot of that depends on your expectations. As physicians, we want to give you pain relief, and that's our number one goal. And if you think of pain as the endpoint of a replacement, we want your pain to be improved. And in general, anatomic replacements and reverse replacements give you very similar pain relief. A lot of times with an anatomic replacement, you get a shoulder that moves more normally. So you have a more normal functioning shoulder. With a reverse replacement, I usually tell you you can expect about 75% of normal motion or better sometimes. The difference is patients with a bad rotator cuff might have a lot less motion to start with. So if they get a reverse replacement and then all of a sudden they can raise their arm 75%, they might have a bigger change in their motion, which makes those patients actually a lot happier in a lot of cases than an anatomic replacement. So what can you expect with shoulder replacement? That's another important question we get in the office. Number one, pain relief. We want the shoulder to feel better. Number two is improved motion. So we want you to feel better, to move better. And number three is try to get back to some of the things that the arthritic shoulder was limiting you from. So I want you feeling better, I want you moving better, and I want you returning to the things that you love to do. That's why we do joint replacements in any part of the body. What's new in 2024 is that over the last several years, we're doing more and more of these surgeries on an outpatient basis. So you're coming into the operating room in the morning, you're getting your procedure done, and you're going home at night. We're able to do this for lots of reasons. One is the technology has gotten better with shoulder replacements. So we use instrumentation that's more specific to patients and that's easier for the OR staff to utilize. It's beneficial to do these things as outpatient for several reasons. When you do them in our surgery centers, myself, my colleagues, my partners, we have more control of the process from start to finish. Even things like sterilizing and processing the equipment, keeping the equipment clean for you, keeping the staff trained and educated on our protocols. Our staff always knows our protocols better than the hospital staff, which may or may not be related to our group. We have a better control of patient care. We see it from the beginning to the end of the procedure. And then we avoid some of the risks that hospitals might give you, which is cross-contamination from other patients that might be there for other reasons. And using our centers allows better management of all our post-surgical patients. So we think that from start to finish, we have more control over the process and a staff that's better versed in what we as surgeons want the patient experience to be. And hopefully that translates to a better experience for you as a patient. What else is new? The biggest thing that we're changing with shoulder arthroplasty is customization. So as technology improves, we get better parts and better pieces. We're able to customize a lot of our implants these days to deal with various deformity, various problems with bone loss. We can use 3D modeling of the shoulder to build glenoid or socket components that are based off of patients' individual CT scans that can fit you better and that can substitute for bony deformities or bone loss or fractures. And we think that using custom implants might give you better results in the long run. All these things are based off of preoperative planning. So we don't just see you in the office. We see you in the office, we evaluate your x-rays, I usually get CT scans. My colleagues often get CT scans. And the CT scans allow us to make a virtual model of your shoulder where we implant the components in different positions to make sure we're giving you the best component positioning as possible. In the future, we'll be moving not only from 3D implantations and 3D customized implants to augmented reality or virtual reality and robotics in shoulder replacements. My next step in the OR is going to be augmented reality. Augmented reality is very nice because by using the headset that's pictured in the middle of this slide, I'm able to view your CT scan and my preoperative plan, which I spent time putting together and knowing exactly where your components are going to be. When I have this headset on, I'm able to see your CT scan as I look inside your shoulder joint. So it'll give me an overlay of what I've already planned outside of the OR. So the augmented reality will help me put your components in better positions and hopefully allow you to have a better outcome after your replacement. So I think that's a very important next step in shoulder replacements. I think we're having a lot of exciting new changes in shoulder replacements, from preoperative planning to component customization to augmented reality. Next will be robotics, which is on the horizon in the very near future. We've been using that for knee replacements and hip replacements somewhat. Shoulder replacements are kind of next on the list for robotics. And we do all these things to try to get better outcome for our patients, better patient satisfaction, and components that last hopefully longer. So thank you all for listening. Thank you for watching, and thank you for coming to our shoulder replacement Facebook Live.
Thank you all so much. It is now time for the Q&A. So if you are watching this live on Facebook, please leave your questions in the comments. We will be answering comments submitted now and ones submitted earlier. Not all questions will be able to be answered, but we will do as many as we can. Dr. Walker, our first question is, when is it time to have a shoulder replacement?
So that's a great question. In general, I see patients every day that have x-rays that look like the arthritis is advanced to the point where on x-ray, that patient might be ready. That said, sometimes patients come in and their x-ray looks bad, but they have very good motion and not a whole lot of pain. Those patients, in my opinion, are not ready to have a shoulder replacement. I always tell patients that you tell me when you're ready to have it done. So if the x-rays show that you have arthritic changes in the joint, but you're managed on medications or injections and you feel okay, you might not be ready. If it gets to the point where it's hurting you really bad, it's interfering with things that you like to do, whether it's sports or work or hobbies around the house, when it's hard to sleep at night, when it's hard to get dressed or bathe yourself, and it's interfering with your day-to-day life, that's when it's time to have the shoulder replaced.
Thank you. What does recovery look like after a shoulder replacement? How long are you in a sling? How long do you need to do physical therapy? And is it different for an anatomic replacement and a reverse replacement?
Yeah, great question. So I will tell you that in my practice, I'm going to speak for what I do, and what I do might be different from what other physicians do. But for me, when you get an anatomic replacement, currently the most common anatomic replacement requires me to move your rotator cuff muscle in the front of the shoulder and repair it at the end of the replacement. Because I have to do that, I want the rotator cuff to heal perfectly, so I slow down your recovery for the anatomic replacements. I keep you in a sling for 4 weeks, where you just move your elbow and your shoulder for arm circles for about a month, and then you start physical therapy after that. And I would tell you that therapy lasts 6 to 8 weeks in general for an anatomic replacement. For a reverse replacement, what I'm doing now is I keep the patients in a sling for just about a week and a half. So your first post-op visit, your sling comes off, you start eating and drinking with it, you start doing some overhead stretches with the arm, and you start therapy a lot sooner. So in my practice, reverse replacement recovery is a little quicker. You're in the sling for less time, you start therapy a little bit sooner. But in general, for both replacements, overall recovery is 10% per month, meaning the shoulder will get better in terms of strength, motion, and endurance for almost a year.
Thank you. Is there an age limit on the surgery?
I don't think there's an age limit on shoulder replacement surgery. I think the most important thing is your health status and your other medical conditions. I have some patients that are in their 80s or 90s, and they have no heart problems and no lung problems, and they walk, around the neighborhood every day, and they're fairly healthy. So I think instead of age being a definite cutoff, I think it's your coexisting medical problems, your medical comorbidities.
Thank you. How long will the replacement last?
So today we've done studies on this, and we know from data from Europe that in general, a shoulder replacement will last for 20 years. And 20 years is probably an underestimate of shoulder arthroplasty. What we have studied over time is called the rate of revision. And the rate of revision for shoulder replacements is 1% per year. What that means is that 1% of shoulder replacements we put in will be revised every single year. So 20 years from now, 80% of the replacements we put in today will still be in place. So in general, you can think of a shoulder replacement lasting 20 years. But a lot of times they last quite longer.
Thank you. Will the shoulder feel different after replacement?
It will feel different. Hopefully it'll feel better. Again, the number one reason to do this is pain relief. An anatomic replacement in general will feel more like your shoulder did before you had arthritis. The reverse replacement comes in various different designs. Every company has a slightly different geometric design to these. And so from a physical standpoint, the reverse replacement may look different. It will move a little differently because it's designed to make the deltoid muscle, the muscle on the outside of the shoulder, move the shoulder for you. So we're changing the mechanics of the shoulder a little bit to compensate for the bad rotator cuff with a reverse. So you will feel a little difference in how it moves and maybe even how it feels on the outside of your body.
Thank you. Are there any restrictions after shoulder replacement on how much weight you can lift or what activities you can do? Specifically, we've had a few people ask about playing golf after a shoulder replacement.
Sure. So in general, this is a great question. And I'll tell you that there's no scientific data on weight limitations for how much you can do after a shoulder replacement. In general, we tend to limit some of the activities that you do. So for example, if you're getting a reverse replacement, I tell my patients I don't want you lifting one-handed 20 pounds overhead, but I can't tell you there's scientific studies that tell you 20 pounds is better than 30 pounds. I don't like you doing pull-ups. I don't like you doing dips, and I don't love the idea of doing free weights like bench presses and things like that after a reverse replacement. But again, this is more me being cautious and not having data to guide my decisions. Golf, I usually tell you for a reverse replacement, wait 2 months. For an anatomic replacement, wait 4 months before you do a full swing. But every surgeon, I might just add, every surgeon may have different protocols for what you can do, how much you can lift, and when you can do those activities. So those are my personal biases and beliefs. But again, not based on scientific data, based on talking to other guys that do shoulder replacements frequently.
Thank you. How is the pain managed after surgery?
Sure. So nowadays in the facilities I operate on, we use a nerve block, which is a 3-day long pain relieving nerve block. So in the past, we used a nerve block that lasted maybe 12 or 24 hours and wore off very quickly. So patients would have pain when the nerve block wore off. Now the nerve blocks we use last for 3 days and patients are very comfortable afterwards. After the nerve block wears off, some people still need pain medications. In my practice, I usually use oxycodone or hydrocodone, which is a narcotic pain medication. But I'll tell you that since we've used the 3-day nerve block, the need for narcotics has decreased substantially. So it's not unusual for patients to tell me that they've maybe taken 1 or 2 or maybe even no narcotic pain pills after surgery. But everybody's a little different. Pain's a complicated issue for a lot of people, and it's very subjective for people. So some people that can get by on Tylenol, there's some people that need Advils, there's some people that need longer courses of pain pills afterwards. So it's a patient-to-patient thing in general.
Thank you. We spoke about there being no maximum age for the surgery, but is there a minimum age?
There is no minimum age for shoulder replacements. In general, we try to avoid doing these on younger patients. I've had patients in their 20s that have had very bad histories of problems with their shoulders that have wound up in shoulder replacements. I've had patients in their 30s, patients in their 40s. We know that younger patients will put more of a demand on their shoulder than older patients. So patients that are in their 30s, 40s, and maybe 50s might be doing more activities that potentially could wear the shoulders out quicker. So I don't want to say there's a minimum age for it, but we are very cautious with who we put them in and how young you are when we put them in. And we want to make sure that at this stage of your life, this is maybe the last resort for your shoulder condition.
Thank you. Can both shoulders be done at the same time?
That's a loaded question. I would say in theory, the answer is yes. And I have done bilateral shoulder replacements on patients who have fallen down and fractured both shoulders. So they started with two injuries on either side. I would never do an elective shoulder replacement at the same time as the other one, mainly because you won't have a hand to feed yourself or wipe your butt. So unless you have a really loving spouse or somebody at the house, you're going to need a lot of help.
Thank you. Why is someone being asked to do physical therapy before their surgery?
Yeah, so we kind of use the term prehab, prehabilitation, I guess, prehab for this. And the nice thing about doing therapy beforehand is if you get the rotator cuff muscle strong or the deltoid strong, or what we call the periscapular muscle stronger, you will bounce back quicker after surgery. So I think it's an important part of getting the shoulder as prepared as it can possibly be before an operation.
Thank you. If someone lives by themselves, can they recover alone, or will they need someone to stay with them for a while?
I think in general, the more support you have at home, the better. Again, if you're having an anatomic replacement, you're going to be in the sling for 4 weeks in my office, give or take. So things like making meals will be a little bit more difficult. I think the more help you have, the better for the first few weeks after the surgery. We definitely want you to have somebody with you for the first few days after to make sure you're able to get dressed okay, to get cleaned up okay, and to get in and out of bed and up and down the stairs if you need to. So I think the more help you can have, the better. In general, we can figure out ways to give you help at home or in a rehab center if you need those things. But I do prefer somebody to help you for at least a couple weeks.
Thank you. How soon after a cortisone injection can you do a replacement?
Yeah, so cortisone works by decreasing inflammation, but it also decreases our body's immune response to things. And we've learned that if we give a cortisone injection, that for the first 90 days after that injection, if we were to do any type of shoulder procedure on you, whether that's an arthroscopic surgery or a replacement surgery, you have doubled your chance of infection after that injection for the first 90 days. So we like to wait 3 months after a cortisone shot for almost any shoulder surgery nowadays.
Thank you. If you have a reverse replacement, is the rotator cuff repaired?
Yeah, this is, again, not a black and white question. In medicine, there's not a lot of black and white answers, but sometimes when you get a reverse replacement, the subscapularis or the front rotator cuff tendon is in very good shape. I move that tendon and I repair that at the end of the reverse replacements if the subscapularis is in good shape and it can reach the right position where I want it to be after the repair. In general, when people who are getting reverses have irreparable supraspinatus, which is the top tendon, and infraspinatus tears, which is the top back tendon. So one of the reasons you get reverse replacements is because those tendons can't be fixed regardless. So those supraspinatus tendons and infraspinatus tendons that are irreparable do not get repaired after a reverse.
Thank you. how long after one shoulder replacement does it take before you can do a second replacement?
Yeah, I think if you're talking about you have your left side done, and then how soon can you have your right side done? My preference is somewhere between 4 and 6 months. And again, that's a bit subjective because some patients might get a reverse replacement on their left, and in 2 months they're moving it very well and they have no pain and they might be ready to have the other side done. But I think 4 to 6 months will give you enough time so that the replaced shoulder will be strong enough and moving well enough to compensate for having the other arm in the post-op period.
Thank you. Can you sleep in a bed after surgery, or do you have to sleep in a chair lounge, easy chair type of thing?
Yeah, after almost any shoulder surgery, it hurts you more when you lay flat. And I'm not sure as physicians we know exactly why that is. I have some theories about that, but we usually recommend sleeping upright somehow, and that seems to take the pain down a little bit. It makes the shoulder throb a little bit less. The short answer is, of course, you can sleep in the bed. You may be more comfortable with pillows behind your back so you're sloped upright a little bit. I had a shoulder surgery myself. I slept on the couch for a couple weeks, and that was very hard. It's hard to sleep after shoulder surgeries. If you have a lounge chair, that might be more comfortable than the couch I was sleeping on. But in general, sleeping upright makes you a little more comfortable, but if there's not a medical necessity to do that.
Thank you. Once someone has bone-on-bone arthritis, is replacement the only option?
Again, that depends. So in some cases, we can do an arthroscopic procedure to deal with earlier forms of arthritis. The arthroscopic procedure I do is called a CAM, C-A-M procedure, stands for Comprehensive Arthroscopic Management. That means I go in there and I try to clean out everything that I can do that might be a pain generator. So I'll shave off some bone spurs. I might address your biceps tendon, which can be damaged. I might trim some labral tissue. I will release what's called your axillary nerve, all these things that give you pain in the shoulder. But that procedure is reserved for certain patients with early arthritis, with decent motion. So it's an option for some people. But there is a point where if the arthritis is so bad and medications aren't working, cortisone shots aren't working, you're no longer a candidate for an arthroscopic procedure, then currently in 2024, replacement is the only option at that point.
Thank you. If you're older and have a rotator cuff tear, should you have a shoulder replacement or a rotator cuff repair?
That's a fantastic question. So the problem with rotator cuffs is that tears come in all shapes and sizes. So I'm going to use a number of being 75 years old. If you're 75 years old and you have a symptomatic rotator cuff tear that's small and the rotator cuff tendons look good otherwise, you get a rotator cuff repair in my office. If you're 75 and you have a big giant rotator cuff tear that might be fixable, but it might not be fixable, the larger the tear is, the less likely it is to heal. Then I have a discussion with you about, hey, should we try to repair this tendon? And I'll give you some numbers of how likely it is to heal, and I'll talk to you about the recovery. Or do you get a reverse replacement? So doing a reverse replacement for a massive rotator cuff tear in somebody who's in a certain age group might be it's definitely a quicker recovery, and it might be something that prevents you from having a rotator cuff surgery and then needing to do a reverse replacement later. So that's a case-by-case question and a case-by-case basis. Depends on kind of the age of the patient, the size of the rotator cuff tear, if it looks fixable, what you want your recovery to look like. So there's no black and white easy answer for that question either.
Thank you. How long is the surgery itself?
The shoulder replacement surgery depends on a lot of factors. One is how many shoulder replacements does your surgeon do and how quickly do they move through the steps. In general, I would tell you 45 minutes to an hour and a half for the actual operation.
All right. Thank you so much, Dr. Walker. That is all the time that we have for today. Dr. Walker, would you like to close?
Yeah, thanks again to everybody who watched. Thank you for great questions. These were always very interesting, and I wish I had a black and white answer for all of these things. We're always happy at OrthoVirginia to take care of all of your orthopedic needs. If you have any shoulder or elbow related problems, I'd be happy to see you in my office on Schrader Road in Richmond. So thank you for tuning in.